Nutritional solutions to slow healing wounds. When a simple cut takes weeks to close, or a minor scrape refuses to fade, your body may be signaling deeper nutritional deficiencies. Hello, this is Jenny. Slow wound healing affects millions of people worldwide, turning minor injuries into prolonged sources of discomfort and potential infection risk. Understanding the nutritional foundations of healing can transform your body's natural repair mechanisms and restore optimal recovery times. Underlying factors. Wound healing is a complex biological process requiring coordinated cellular activity, protein synthesis, and tissue regeneration. Several factors can disrupt this intricate system, leading to delayed recovery. Health conditions. Several health conditions play a significant role in healing capacity. Diabetes impairs circulation and immune function, while autoimmune disorders can interfere with inflammatory responses necessary for repair. Cardiovascular disease reduces blood flow to injured tissues, depriving them of essential nutrients and oxygen. Age-related changes in collagen production and cellular regeneration naturally slow healing processes. Lifestyle factors. Additional barriers to optimal healing include certain lifestyle factors. Chronic stress elevates cortisol levels, suppressing immune function and protein synthesis. Poor sleep disrupts growth hormone release, which is crucial for tissue repair. Smoking restricts blood vessels and reduces oxygen delivery to wounds, while excessive alcohol consumption depletes essential vitamins and minerals needed for healing. Dietary deficiencies. This issue represents the most overlooked yet controllable factor in slow healing. Modern processed diets often lack the specific nutrients required for cellular repair, collagen synthesis, and immune function. Environmental toxins, medications, and chronic inflammation can further deplete these crucial nutrients. Common types and symptoms. Slow healing manifests in various ways that significantly impact daily life. Minor cuts and scrapes that normally heal within a week may persist for weeks or months, remaining red, swollen, or prone to reopening. Surgical incisions may show delayed closure, increased scarring, or persistent tenderness long after expected recovery times. Chronic wounds, such as pressure sores, diabetic ulcers, or persistent skin conditions, represent more severe healing impairments. These often become infected, requiring medical intervention and extended treatment periods. The impact on daily life extends beyond physical discomfort. Persistent wounds limit physical activity, affect professional performance, and create ongoing anxiety about infection or permanent scarring. Simple tasks like washing dishes or exercising become challenging when wounds won't heal properly. Self-assessment methods. Several indicators can help you evaluate your healing capacity. Monitor how long minor cuts or scrapes take to heal completely. Normal healing should show significant improvement within 3 to 5 days for minor wounds. Notice if you develop frequent infections, experience unusual scarring, or find that old injuries easily reopen. Observe your overall energy levels, immune function, and recovery from illness or exercise. These factors often correlate with wound healing capacity. Keep a healing journal noting wound appearance, pain levels, and recovery progression to identify patterns or persistent delays. Common solutions. Effective wound healing often requires a multifaceted approach that combines medical treatments, lifestyle management, and nutritional support. External wound care. Traditional topical treatments include antibiotic ointments, advanced wound dressings, and proper wound cleaning techniques. These approaches focus on creating optimal healing environments, preventing infection, and protecting wounds from further damage. Treating underlying health conditions. Managing diabetes through blood sugar control, treating cardiovascular disease to improve circulation, and addressing autoimmune disorders with appropriate medications can significantly improve healing capacity. Proper management of chronic conditions creates a foundation for better healing outcomes. Lifestyle modifications. Implementing healthy lifestyle changes can significantly impact healing capacity. This includes getting adequate sleep to support growth hormone release, managing stress through relaxation techniques or counseling, quitting smoking to improve circulation, limiting alcohol consumption to preserve nutrient stores, and incorporating gentle exercise to promote blood flow and overall health. Advanced medical interventions. Medical treatments such as growth factor therapy, hyperbaric oxygen treatment, surgical debridement, and specialized wound clinics offer targeted approaches for severe or persistent healing problems. These interventions can accelerate healing in complex cases. Nutritional solutions. While medical treatments address external factors and underlying conditions, nutritional solutions work synergistically by supporting the fundamental biochemical processes that enable optimal healing from within. Proper nutrition provides the building blocks and cofactors necessary for cellular repair, immune function, and tissue regeneration, enhancing the effectiveness of other treatment approaches. Specific nutrients play vital roles in wound healing. Protein and amino acids provide building blocks for new tissue formation and repair. Specific amino acids like arginine and glutamine become conditionally essential during healing, supporting immune function and nitrogen balance. Complete protein sources include lean meats, fish, eggs, and dairy products. Vitamin C serves as the cornerstone of collagen synthesis, the protein that forms the structural foundation of healing tissue. It also functions as a powerful antioxidant, protecting healing cells from oxidative damage. Deficiency severely impairs wound healing and increases infection risk. Rich food sources include citrus fruits, berries, bell peppers, broccoli, and leafy greens. Vitamin A regulates epithelial cell differentiation and immune function, crucial for proper wound closure and infection resistance. Beta-carotene from orange and green vegetables converts to vitamin A as needed by the body. B-complex vitamins support energy metabolism and protein synthesis required for cellular repair. Vitamin B6, B12, and folate are particularly important for DNA synthesis and red blood cell formation. Sources include whole grains, lean meats, eggs, leafy greens, legumes, and nutritional yeast. Vitamin D modulates immune function and inflammatory responses, supporting optimal healing environments. While sunlight exposure provides some vitamin D, dietary sources like fatty fish and fortified foods become important, especially in winter months. Zinc regulates over 300 enzymatic processes involved in protein synthesis, DNA repair, and immune function. It's essential for proper inflammatory response and tissue regeneration. Oysters, red meat, pumpkin seeds, and legumes provide excellent zinc sources. Omega-3 fatty acids reduce inflammation and promote skin health. Found in fatty fish, flax seeds, and walnuts. Comprehensive health supplement. Optimal wound healing requires a comprehensive network of nutrients working synergistically to support cellular repair, immune function, and tissue regeneration. While vitamins and minerals from a daily diet are essential, they may not always suffice to address the increased demands of the body during wound healing. Considering a high-quality comprehensive health supplement can provide a well-balanced network of essential nutrients, including multivitamins, minerals, and trace elements, to support optimal healing, overall health, and well-being. Wound healing is a complex biological process that, when impaired, can turn minor injuries into prolonged sources of discomfort and potential infection risk. A comprehensive approach combining proper wound care, effective management of underlying health conditions, and a strong nutritional foundation can transform your body's natural healing capacity and restore the efficient recovery times you deserve. Thank you for watching. Please subscribe, like, and share this channel to receive more updates on health and anti-aging. Bye for now, and see you again soon.